Hi everyone, my name is Jenny Gunckle and I am an IWSA board member and mom to Emma, who is 8 years old. Say hi, Emma.
Hi.
So I'm here today to provide all of you with a really exciting update on the WAGR syndrome patient registry. Since the registry was developed by the IWSA in 2015, we've said over and over again that this data provides hope for those living with WAGR syndrome. And I think you'll understand a little bit more about what this actually means after you hear more about what's been happening over the past year. But before we get to the good stuff, for those of you that might not know, the registry is an online questionnaire of 77 questions in an IRB approved survey. It's hosted on a secure server by the Coordination of Rare Diseases at Sanford, or CORDS, and it can be completed online or with printed copies by adult patients themselves or parents or guardians. Currently, we have over 140 patients with WAGR syndrome represented in this data, which means that our registry has the largest collection of standardized information about individuals with WAGR syndrome in the world. But the main purpose of the registry, of course, is for our data to help better understand the conditions associated with WAGR syndrome and really to potentially develop treatments or therapies that could help improve the lives of our kids and future kids to come. As with WAGR syndrome, when so few patients with the disorder exist, getting each and every patient around the world to enroll in the registry is so important. And as many of you might remember, probably, last summer we launched a full-scale campaign to increase enrollment in our registry. And you might have seen one of our many videos where we actually heard from over 50 people talking about the benefits of enrolling and annually updating your registries. If you missed any of these videos, you are able to find them anytime on the IWSA's public YouTube channel. But at the end of the day, this campaign exceeded all of our wildest expectations and increased our records by almost 80%. So to each and every one of you who took the time to enroll or update your registries, thank you. Honestly, whatever amount of time it took you to do this was well worth it. And this is because in the past year, we have had 3 researchers obtain approval to access our registry data. Cue fireworks. These include a geneticist who is studying the gene mutations associated with aniridia, a team of pediatric cancer researchers who are studying Wilms tumor in WAGR syndrome, and a team from the Children's Hospital of Philadelphia led by Dr. Jen Kalish. And you might know Dr. Kalish spoke at last year's WAGR weekend, and she is here with us again today to provide an update on the unbelievable progress her team has made this year and some of her exciting plans for the future.
Hi, I'm Dr. Jennifer Kalash, a clinical geneticist and researcher at Children's Hospital of Philadelphia. My clinical work and research focus on studying cancer predisposition syndromes such as WAGR syndrome and Beckwith-Wiedemann syndrome. This work includes clinical and characterization of these rare syndromes and developing clinical care guidelines. Registries are essential to understand how to diagnose and care for patients that have rare diseases like WAGR syndrome. The data collected through patient registries helps us to learn about the experience of each patient and what medical issues they may face. We then use this information to guide physicians and other healthcare providers to try to improve care for patients with WAGR syndrome. In order to study patients, we need to systematically collect patient data in the patient registries, like the WAGR syndrome patient registry. The more patients that are available to study, the more powerful the collection of data becomes. A challenge in rare disease research includes the small numbers of patients that are affected by a given condition. This means with rare diseases like WAGR syndrome, every patient who participates in the registry is very important, and we need as many patients as possible to join. The information for those who've joined the WAGR syndrome patient registry already has helped us to understand more about the different features that affect patients. Your information has shown us that WAGR syndrome has a number of common features beyond the classic definition of the syndrome. Therefore, in collaboration with the International WAGR Syndrome Association, we now consider WAGR a spectrum rather than just a syndrome. We have recently submitted the summary of our findings for publication in a medical journal, with the goal of this publication to include the characterization of clinical features in the WAGR spectrum. We have developed updated clinical care guidelines for patients and families with WAGR spectrum to share with their own care teams. We anticipate these guidelines will extend the current approach to WAGR spectrum. In addition, we have submitted abstracts to several genetics and oncology conferences to share this information with the broader clinical and scientific community. We are also working on developing additional research projects and questions and are always interested in learning more about family-centered research priorities. For those who have already joined the WAGR Syndrome Patient Registry, thank you, as this project would not have been possible without your participation. You are welcome to update your information at any time to help us learn more about the long-term outcomes of WAGR spectrum. For those who have not yet joined, please consider joining, because the more data that is shared, the more we can work to improve understanding and care for WAGR spectrum. We look forward to sharing more data from the work that I've just discussed in the coming months, and I thank you very much for your attention today.
Dr. Kalish and her team have invested countless hours collecting and interpreting our data. And honestly, what is happening right now is a dream come true. Over the next few months, you'll be hearing a lot more from us and from Dr. Kalish, talking more specifically about this article and how it can benefit your child's care. So please be on the lookout for all of that information coming soon. But as Dr. Kalish and others down the road continue to move forward with their research into WAGR syndrome, there really is no better time than now to enroll or update your registry data. And you can find all of the information that you need to do that on our website at wagr.org/WAGR-syndrome-patient-registry. And hopefully, I know that's a mouthful, but hopefully you can see that on your screens right now. You can also find the registry page directly from our wagr.org website. Just navigate right to wagr.org, and here's our homepage right here. You can see the tabs right at the top, where if you go under the research tab, there's a link right there, the WAGR Syndrome Patient Registry, right underneath. If you click on that, it'll take you directly to the page. You'll notice right at the top of the page this orange button that says Enroll or Update Now. This button is going to take you directly to that CORDS enrollment page, where you can enter in your login information if you've already created that, or you can click Not Yet a Participant, and you can sign up to enroll in a new registry. Going back to our IWSA page, there's a lot of other information on this page that you can go through on your own. This video here at the top is a YouTube video that was a compilation of videos created by patients with WAGR syndrome themselves. If you haven't seen this, check it out. It's definitely worth the couple minutes to watch that. And I think the other thing that I'll point out, if you go down a little bit further on the page, there's this question that says, how do I register? And right here, we have a registry FAQ with a bunch of questions and answers on how to enroll in the registry and, lots of common questions there. You can click on that and get it right in English, or the FAQ, we've also made it available in multiple other languages as well. So just click that orange button there, and then you can find it in other languages. Maybe the other thing I'll point out here, this one under Why Should I Register? This will take you directly to our YouTube channel, the IWSA's YouTube channel. So if you click on that, it'll take you out to YouTube, and you can see all of the different videos that we have available in our channel. And if you go down a little bit, you'll find the videos for the WAGR syndrome patient registry campaign that we had last summer. So if you missed any of those are all available on our YouTube channel as well, along with a lot of other videos also. So if you have any questions on the registry, I would definitely highly recommend taking a peek at this webpage here. Lots of really good information. But as I said before, and as many others have said, with such a small patient population like ours, every single entry makes a really big difference. So please reach out to us if you have any questions or issues with enrolling. If there's any barriers for you to enroll online, please let us know and we can mail you a paper copy. I know the registry is in English, but if it's challenging for you to complete the registry in this language, please feel free to reach out to someone you trust, a friend, family member, healthcare professional, or even if it's available, your country's Aniridia patient organization to help you with the translation. With this registry data comes power. The power to know whether something is a WAGR thing, the power to formally publish care guidelines to help our kids get the treatments that they need, and the power to help entice researchers to further study our rare disease. Hope is one short survey away. Thank you everybody so much, and we hope to see you again in future years in person WAGR weekends. Have a great day, everybody. Bye.
Bye.